Hi everyone, welcome back to our podcast, Voice of Care, Caring from the Heart. So for today's topic, we'll be talking about plastic surgery. And when people think about plastic surgery, what do they usually thought? Is it usually a breast augmentation or is it like a facelift? Other than that, we also have a rhinoplasty, or in layman terms, we call it a nose job. So to speak about more of this topic, trying to understand it, why do people do it and such, so we have our esteemed guest for today. We have Dr. Leow Aik Ming, our plastic surgeon. Doctor, you want to introduce yourself?
Yeah, thank you for the kind introduction, Ms. Shirley. Good morning to everybody. I think it's a good platform for me to highlight certain aspects of plastic surgery, which we perform quite a lot and quite regularly in Pantai Hospital Ipoh. So I'm glad to be here, and also I'd like to convey my sincere appreciation for this event. Thank you.
Thank you, Doctor, as well.
Yeah.
So let's go straight into the topic. So for the first question, what exactly is rhinoplasty or a nose job, Doctor?
Yes. For rhinoplasty in the layman term, so as you mentioned, is a nose, is a surgery that aim to correct the nose, okay? Basically it involve a surgical procedure as well as a non-invasive procedure. But what I would like to highlight to you is a lot of this transformation can be done through surgery. And you have to understand that the history, the evolution of rhinoplasty techniques is just not over the night. It has been there since about 6th century ago. Well, let me elaborate on that. So you see, the first rhinoplasty was performed by an Indian so-called physician and also surgeon back in the 6th century.
Wow, very long ago.
His name is called Susruta. So from the documented evidence, so he has shown that he has performed a surgery using a flap, that means the skin and the tissue, from the forehead turn to correct the mutilated nose. Because you have to understand, during that period of time, one of the punishment of the criminal is amputation of the nose.
Oh, very severe.
So what happened was the nose, the tissue from the forehead can be used to reconstruct the nose. Then from there on, during the Great Wars, such as the First World War, Second World War, and the Korean War, the techniques of rhinoplasty evolved and then also have improvised many techniques, many approaches to reconstruct the nose that sets the foundation of modern rhinoplasty.
Since we have a lot of technology and advancements, right? So for rhinoplasty, there are a lot of techniques on how doctor will approach it, right? So usually, how do you treat the patients?
Okay, you see, you have to understand before you're talking about treatment, so you must know about what are the purpose, the indication. So I will coin everything together into three main indications. First is the correction of the function. The foremost importance is the correction of any breathing issues. So that comes a big bulk of the rhinoplasty work that we do to improve the breathing, the health, and the quality of life of the patient. Second part is the aesthetic concern, because a lot of patients who come to see us is because there are some deformities or perceived deformities that doesn't fit well to the patient's preference, that they want some form of transformation. And the third is psychological effect, because once you have a good nose and a good breathing function, patient has a very positive psychological impact. So in terms of self-confidence and also maybe the health improve, the mental health as well. So those are the three main purposes of rhinoplasty.
I see. So rhinoplasty is not only about a cosmetic procedure, but it's also functional and help us to improve our overall well-being.
And the psychology, right? As well. The psychology. A lot of people miss on that. So that's why when you perform rhinoplasty, we have to assess them carefully. So now the question comes is, who are the ideal candidates for rhinoplasty? So in order for you to be a good candidate for rhinoplasty, so as a surgeon, always we evaluate. So very important, patients should have a realistic expectation. So this is a very important issue that we have to address. Patient may have very unrealistic expectation. So if you have an unrealistic expectation, sometimes where your discussion the patient's discussion with the surgeon do not come aligned. So it can be a problem later, but during the process of recovery and the aesthetic outcome. Second thing is, as I mentioned before, function. So if you have a real breathing function, so I think that would be a good candidate for rhinoplasty. To some extent, we can correct the breathing problem. And the third is the patient who has some aesthetic concern, which is a real aesthetic concern, can be identified through discussion, through assessment. Surgeon identify what the patient sees. If they come in aligned, then there's a good candidate. The fourth is patient who has some problem. So like certain impairment he perceived is not ideal. And then also, what you need to do is you need to look into that and then discuss and see whether this kind of surgery can be performed. And also, patient should be healthy, does not smoke excessively, or should stop smoking before the surgery. And certain medication will stop, and also the most important is patient comply with the post-op instruction. I think this is the most important aspect, because sometimes you have, nowadays, there are so many things in social media. Patient will get post-operative information from the social media, despite the surgeon has informed the patient what to do. So that can impact the outcome. And to me, this is not the ideal candidate, because you should respect the surgeon's advice and follow that treatment protocol to ensure good recovery and good outcome.
And coming back to this topic, right, when it comes to having rhinoplasty and with the ideal candidate, like for example, those who are compliant with the doctor's advice as well, and then the current medical condition, how about age? Does it affect when should you get rhinoplasty?
No, age is not the main indication to withhold rhinoplasty. You see, there are certain type of rhinoplasty can be done at 3 months old. Let me elaborate on that. This is the cases where patient born with a cleft.
The cleft
lip.
here.
So my approach, my philosophical approach for cleft repair also involved the nose. So what happened is, during the 3 months period of time, 3 to 6 months is the ideal age for cleft lip repair, cleft lip and nose repair. So I will incorporate reshaping or reconstruct the nose during that time. Okay, that's the younger age group. Whereas the extreme age group, if patient is healthy, no other contraindication, they can go ahead and do it. It doesn't matter. So it's just that whether what the patient want, So to the extreme, there's no indication unless patient is healthy. And then to one younger extreme is 3 months to 6 months years of
I
age.
see. And then since Malaysia is quite a diverse country, right? We have multiracial, different types and sizes of noses as well. So how do you guide them and advise them through the surgery and also after and before?
Okay, so good question. You see, we are living in a multi-ethnic, multicultural society. Therefore, before I jump into that topic, let me explain to you. In the human population, there are 3 morphological patterns of the nose, which means the shape, the nasal framework, the cartilaginous framework, and the skin overlay, all are different. So there are 3 main distinctive categories classified as the leptorrhine nose. Leptorrhine nose is those, I give you an example like the Caucasian nose. High bridge nose. Yeah, very strong nasal framework, and then the skin is thin. And then there's another group called Mesorrhine. Mesorrhine is more like an Asian type, where the dorsum is not so high. The framework is moderate, skin also relatively thick. Another one is called Platyrrhine. Platyrrhine are those with, like, I would say that like Africans or the Negroes, whereby their nasal dorsum or the framework are weak and low. So the skin are very thick. So they all these give a distinctive characteristics of the nose. But because over the centuries, human migration, inter-ethnic marriage, so we have more than 3 types of noses. So they are a mixture of that. So that makes rhinoplasty very unique. So you see, it implies to the technique we use. So you see, like for us, the Asian rhinoplasty surgeon are not well versed with the technique used in the Western, because their approach are different. But to me, we are very lucky. We are in Malaysia. We have 3 spectrum of nasal morphology that we see. So, as for me, I have exposure for all these, the Western and the Western. So we can deliver more onto the the expected outcome for the patient. But nevertheless, you see, the essence of this whole procedure is understanding what the patient wants. Second is to preserve the ethnicity of the patient. So we try not to make the patient has an operative look. Okay, so it's very important. So that like you perform a rhinoplasty, you see, oh, the patient looks different, but I cannot tell you what's going on. That's a good surgery. The third one is should not westernize the patient's nose.
True.
Too much. You see, like an Asian, you make it like a Western. It doesn't fit the anatomy.
It doesn't weigh harmony.
Yeah, it lost the harmony and the proportion. So these are the things that we have to really take into considerations. Yeah.
Especially, I think currently we have different and evolving beauty standards, right?
Yeah.
Many people want to have like the more westernized button nose, all of those stuff.
So in terms of that, you see, as the society progress and the economic status improve, so these things come into play, and of course the social media. So there is a condition, we call it cultural evolutions, whereby there's a importation of ideas, the beauty standard from the Westerns, okay, and then another group is from the Korean, from the Japan, or now from the China or whatever. So that will determine what the patient wants, sometimes the preferences. So it's very important for a surgeon to discuss in detail what the patients want, because sometimes patients have their own perception, what they want, their beauty standards are based on their ethnicity or the influence from their friends or social media. But the exact anatomy of the nose cannot deliver that.
It's different,
so
right?
you have to really discuss on that, what can be done, So it's a very intricate procedure, and also it's a surgery that requires understanding the patient's mind. That's why I say rhinoplasty is not only for function and aesthetic, it's the mindset of the patient. We should understand what the patients want. So that's really make rhinoplasty challenging. Challenging in understanding patients' mind, the mindset, their preferences. Second thing is the anatomy of the individual. Each ethnic have their own distinctive anatomy, the skin, all those things, and then the surgeon's skill as well, whether he can deliver or not. So these components are very important in rhinoplasty.
Then when it comes to your practice, right, how do you guide them in achieving that said nose that they wanted to have? Do you give like some visual images to help them to visualize, or how?
Yes, I do that. But as I mentioned earlier, you should understand the patient well. Before any surgery, understand what the patient wants, whether they have the realistic expectation, assess their anatomy, whether you can do that, and then of course you need to have a proper assessment, not only the nose, okay, but also need to assess the functionality of the breathing apparatus. That's the nose, okay, and then also the health conditions, and then later on we do some assessment intranasal assessment, and sometimes we need to do a CT scan, to assess the overall structure of the nose, of the facial anatomy. And then what I would normally do is I will discuss in detail, I discuss with the patient in detail what kind of transformation they are looking at. Because the idea of creating a beautiful nose, you should based on not only the nose per se, but the facial harmony. Every face is different.
Correct.
The anatomy is different, and then the patient's perceptions also is different. So that's why we need to collaborate together and in order to give a good outcome.
I see. And then considering that now we know rhinoplasty is a function and also how a doctor guides through them, then for those who are considering whether to get rhinoplasty or not, what key advice would you give to them?
Well, I think most important thing, you have to come and talk to us what you want. It's very difficult. I do have a lot of online consultations from local or overseas, when they discuss, but in the end is how you need to assess the anatomy. We can talk about idea, what the patients want, the preference, but it's very difficult to assess the anatomy of the nose without face-to-face consultation and assessment. So that's why I say, when you want to have a rhinoplasty, always do a research first, whether the surgeon is capable of delivering what he can do, he can perform. Second thing is understand what you really want. And the decision of surgery should be solely
ourselves.
on the patient, not influenced by anybody. Because this is the key factors now for determining the outcome. Because if you have some influence from other people, when the influence change, your perception change, your idea change, and get your health check, your nose check, then you talk about the surgery. Because there are so many techniques you can do, you see. So I personally felt that if you want to do a proper nose, you must understand the patient well. Patient will come for a consultation, do an assessment, and we talk about the procedure.
Then from there, then the patients can make informed decision.
Yes, that's right. Everything should be laid out, inform the patient what are the possibilities, what are the complications as well, because it's not a walk in the park. Any surgery carries some form of risk, so healing process is different, and then the outcome is different.
And speaking about the healing process, what can one expect after having rhinoplasty? Because many are scared about the healing process, how long will it take to recover and the pain and all?
No, healing process is normal for human beings. See, so you should be patient. I think you should, if you have a good health, good post-operative recovery, there shouldn't be any problem. But I will always tell my patient, in order for you to see the final outcome of the nose, it's not 1 or 2 weeks. It takes about a year sometimes.
Oh, it's very continuous.
It's continuous. The nose will gradually remodel, the reshape, the skin envelope will mold onto the nasal framework. So you should be very patient, because the overall structure, the shape, the contour, the skin, overlying skin of the nose, everything will take time to heal. So every structure has their time frame. So I'll always tell the patient, if you are doing a primary, which means a nose that has not been touched before, it's about 9 to 12 months. All right. But if you are doing a revision, multiple revision, it may take more than a year plus or to 2 years sometimes.
Or very long.
Yes. So patient has to be very patient and also trust your surgeon and come for follow-up all the time.
So it's always important to have a follow-up consultation.
Definitely. Surgery, always you require follow-up. It's not like you don't follow up.
Not one time, not touch and go.
Yeah, it's not. I wouldn't recommend that, because it's not good. Yeah, it's not good for the patient. It's not good for the surgeon as well, and it's not good for the patient and the surgeon's relationship.
True also.
Yeah. All right.
Then because sometimes people are afraid of rhinoplasty, right? Then they opt for nose fillers. So what's the main difference between these two?
You see, you have to understand the nose filler is not the ideal treatment for the nose. Maybe for some irregularity, you can use filler. And there are so many types of fillers that you can use. It depends on whether it's temporary or permanent filler. But usually I will recommend a temporary filler. But filler is only for camouflage. It cannot build the structure. So, and also you have to understand, filler must be injected in a proper way. So if you do not know how to inject, it go to the different layer of the nasal skin envelope, it can cause problem.
Deformities as well.
Deformities, irregularity, bumps, granuloma, scarring, fibrosis. The worst part is sometimes you inject it into the vessel. So if you inject it to the vessel, so the patient may have a skin necrosis, or sometimes can cause blindness.
Very dangerous.
So that's why I won't advocate anyone to try filler. So that's another end that non-invasive methods that people use to augment the nose is by thread. So thread leaf to the nose, also I will say shouldn't do, because that is a very wrong thing to put into the nose, because it will cause fibrosis and it will change the whole soft tissue envelope. It's just to augment, that's all. It doesn't any helps in the framework or anything. Because when we do a rhinoplasty, we have to not only managing the skin, but the framework.
Everything.
The framework is very important, because you want to augment, you want to push up the nose, or you want to reduce the nose. You're talking about the nasal framework, how you manage the nasal framework. Right.
So I think in short, right, as with any major surgery for rhinoplasty, it's also important to have a consultation with doctor to make informed decision, knowing about the benefits and the risks.
So I think, in a nutshell, for any aesthetic procedure, you should understand what the patients want, the psychology of the patient, whether sometimes is it feasible or not. Is the changes that the patients want, does it make sense to you?
Realistic,
Because realistic. So it's very important. Patient have realistic, and sometimes you have to understand the rhinoplasty patient is a different kind of patient because you have to understand why. Because nose is the central part of the face that it attracts a lot of attention.
True.
So sometimes patient may see things that you don't see as a surgeon. Then you should ask yourself, is the patient okay or not? Because there are also psychological conditions.
Body dysmorphia?
Yeah, the body dysmorphic disorders. So that can be also a big problem because for body dysmorphic disorders, whatever you do, in the end, patient will not be happy. So it's better not to touch this kind of patient. So this category of patient are always considered as not the ideal candidate for surgery. So maybe you need some counseling or refer to a psychologist or psychiatrist to evaluate before proceed with any aesthetic procedures. Yeah.
So in short, I think we have learned a lot today about rhinoplasty.
Yeah, welcome.
So I hope the audiences, you guys can know more about rhinoplasty. Not only is about cosmetic, but it is also about improving your well-being, your life, your psychological well-being as well. So I think that's it for today's podcast, and a very thank you to Dr. Leow. Thank you as well for sharing a lot of insights regarding rhinoplasty, including even the history as well. It's very interesting.
Welcome.
All right. So for the audience, make sure to follow us on all of our social media, including Facebook, Instagram, YouTube, Twitter. So make sure to like, follow, and subscribe. And if you have any questions, make sure to leave a comment as well. Thank you. Bye.